Hello, good morning, everyone. Uh, I am back with one of the newer report which has been came on the 7th of this month, Global Tuberculosis Report on 2023. I am very glad to share it with you that WHO acknowledged India's success in declining TB incidence by 16% and TB mortality as well reduced by 18% as compared to the data of 2015. And this official report is outed by Government of India as well uh, on their PIB reports on the dashboard as well on the website, and the link is shown over here as well. And I will provide that in the description. And it's like basically a very great achievement for India, and it has been acknowledged all the WHO Mediterranean part in the Southeast Asia region. India has performed very well and declining incidence as well as mortality reduction. So all the public health professional like basically after listening this our achievement our country's achievement, that will feels better that we are working on the same field to achieve our that goals as well as targets set by the country as well as universal level at the world level, that as well. So let's start with this. So before going to the deep in this global report, so some of the parts should be known, the overview. So the Global Tuberculosis Report of 2023 was produced by a core team of 13 people in WHO Global Tuberculosis Program. If you want to know about these 13 people who were in this report, likewise in this team, so that details has been also produced in the report, so we can also check on this if anyone knows, if anyone want, and if anyone is curious about to know. Specific to these 13 people as well as uh, all the WHO participants who participated from Southeast Asia region as well. The name is given over there. Team organized all aspect of data and code management, including the preparation and implementation of web system used for the 2023 round of global tuberculosis data collection from 215 countries and areas. Likewise, global tuberculosis report comprising six standard topic and six features topic. So directly in this part, I am discussing on the six standard topic only, and in the next part we will check about this all the data for India, and the next series of this will come while comparison of India and with any another countries which is having a population equivalent to India as well. So six standard topic which has been covered in this. The first is very well known TB disease burden, including TB incidence as well. Second, TB diagnosis and treatment. That obviously that the part is coming like this after knowing the incidence, then diagnosis and treatment. Third, TB prevention and screening as well. Fourth, financing of tuberculosis prevention, diagnostic and treatment services. Fifth, why I have highlighted that I will show universal health coverage and TB determinants. I have highlighted due to my personal views on this. We'll discuss in the next upcoming slide. And the last, TB research and innovation as well. So the major finding from this global report in 2022, there was global recovery in the number of people diagnosed with and treated for tuberculosis after 2 years of COVID-related disruption. TB remained the world's second leading cause of death from a single infectious agent in 2022 after COVID-19. The reported global number of people newly diagnosed with TB in 2022 with 7.5 million, the highest since WHO began global TB monitoring in 1995. The three countries, India, Indonesia, and Philippines, which accounted for the large share of global reduction in TB diagnosis in 2020 and 2021, all recovered to above 2019 level in 2022. Globally in 2022, TB caused an estimated 1.30 million deaths, down from 1.4 million in both 2020 and 2021. COVID-related disruption are estimated to have resulted in almost half a million excess deaths from TB in year 20 to 22. So after going through a complete guideline, I have find it out 18 finding from the report which I'm sharing. The six is over here. The next six is this one. The net reduction in global number of deaths caused by TB from 2015 to 2022 was 19%, falling short of the WHO INT strategy milestone of 75% reduction by 2025. Worldwide, an estimated 10.6 million people developed tuberculosis in year 2022, up from 10.3 million in 2021. The global gap between estimated TB incidence and reported diagnosis narrowed to 3.1 million in 2022, down from around 4 million in 2020 and 2021. The estimated tuberculosis incidence in 2022 was 133 per lakh population, falling short of the WHO in TB strategy milestone of 50% reduction by 2025. 30 high burden countries accounted for 87% of world TB cases in 2022, with India, Indonesia, China, and the Philippines leading. If you want to know the details of these 30 high TB burden countries, then you should refer the Global TB report 2023. Apart from this, some interlinked report is also over there. You will come to know about complete list of these 30 countries. And among these 30 countries, the leading countries is India, Indonesia, China, and the Philippines leading. So in the upcoming video, I will do the comparison of India either with Indonesia or with China or with Philippines. In 2022, 55% of people who developed tuberculosis were men, 33% were women, and 12% were children. So the remaining, this is 12 findings from the report. The remaining 6 findings is over here. Sorry. Globally, an estimated 410,000 people developed multi-drug resistance or rifampicin resistance tuberculosis in 2022, with only 175,650 diagnosed as well as is started on treatment. If you will go through TBC India report of 2023, which has been released on this World TB Day at Varanasi. So you will come to know about this key, the part over here which is written 1,75,650 diagnosed and is started on treatment. So you will get that specific data as well as indicator put on treatment. The next global target set for the 5-year period 2018 to 2022 were not achieved, with 84% of the 40 million treatment target and 52% of 30 million preventive treatment target reached. So we will discuss more details of these both indicators, likewise where we are discussing 40 million treatment target, 30 million preventive treatment target. Funding for tuberculosis services in 2022 was US dollar 5.8 billion, below pre-COVID level and less than half of the target of at least US $13 billion per year by 2022. Investment in tuberculosis research averaged just under US $1 billion per year, less than half of the US $2 billion target. So we will see the infographics of this indicated as well, that the target was set at previously at $2 billion US. About 50% of TB patients and their household face catastrophic cost, that is household income given, indicating major economic barrier to assessing and completing TB treatment. Treatment success rate has have improved, reaching 88% for drug susceptible tuberculosis and 63% for multi-drug resistance or rifampicin resistance tuberculosis. So this is the major finding which I am able to drag it out from the complete report. So these 18 were over here, which has been discussed all. Now the target which has been set it previously in various reports and milestones. Likewise, ki WHO in tuberculosis strategy to the 2025 milestone. So milestone set for TB incidence rate is 50% reduction in TB incidence rate by year 2015 to 2025. Among this, the achievement is 8.7% reduction has been achieved in the duration of 2015 to 2022. So the target which has been set for number of tuberculosis death, so 75% reduction has been set for 2015 to 2025. So as of now, it has been achieved 19% of reduction in the duration of 2015 to 2022. The third one, percentage of people with TB facing catastrophic total cost. Milestone has been set for this for 0 in 2025. 49% of people with TB faces catastrophic total cost as reported. So more detailed version if you want to know, so you have to refer this complete guideline set over there, complete report set. The next upcoming, the UN high level meeting on tuberculosis in year 2018, treatment target has been set. Treatment TB treatment for all age target has been set 40 million for the period of 2018 to 2022. From 40 million, 34 million has been achieved, that is 84%. So that's shown in the blue. In the previous one, you were able to say that key when it is lower, then it has been shown with red color. So for this, 84% has been achieved. TB treatment among the children target set for 3.5 million for the duration of 2018 to 2022. Duration will remain same, and the achievement is 2.5 million treatment for TB for children for TB treatment in the duration of 18 to 2022. While on the other hand, target set for multi-drug resistance or rifampicin resistant treatment for all ages, that is 1.5 million. Among this, the achievement is 55%. Apart from this, multi-drug resistance and rifampicin resistance treatment, especially for children, the target set for this, so 111500, and among this achievement is 19% only. The next, again, it's gone for UN high level meeting on tuberculosis in year 2018. Tuberculosis preventive treatment target. So all a target for all ages was 30 million. and achievement is 15.5 million, which is 52%. People living with HIV target set for this is 6 million, and this was the indicator on which we have crossed that target. We have achieved more than that target, that is 11.3 million. Household contact is this one. For this, like basically 4 million has been set a target, and we have achieved for this likewise 55%. On the other hand, uh, less than or equal to 5 year. So 20 million was target, and we have achieved 10% only. So as we have discussed in the finding part, so funding target has been set for universal access to tuberculosis prevention, diagnosis, treatment, and care. Target was 13 billion US dollar annually by 2022, but the achievement is 44%, which is with around that 5.8 billion US dollar in 2022. On the other hand, for TB research, target was US dollar 2 billion annually for the period of 2018 to 2022. 50% has been achieved in 2021. US dollar 1 billion has been reached. So, the previous one, why I was highlighting that, so I was got one of the opportunity to participate in universal health coverage from the UN, which was uh, which has to be held at UN headquarter on the 8th and 9th May 2023. This is from that. So now that PIB released from the government of India, so they have like basically reduction of tuberculosis in incidence almost double the pace of decline in global TB incidence. Improvement in treatment coverage to 80% of the estimated TB case, increase of 19% over the previous year. Significant progress made under the Nikshay Mitra Abhiyan, which is still ongoing. So the WHO released its global TB report for 2023 on 7th November, and for the same PIB has been released on 8th of this month, November. According to the report, India has made tremendous progress in improving case detection and reversed the impact of COVID-19 on the TB program. The treatment coverage has improved to 80% of the estimated TB cases, an increase of 19% over the previous year, which is very good to hear for India. Proud moment for us. India's effort have resulted in reduction of TB incidence by 16% in 2022 from 2015, almost double the pace at which global TB incidence is declining, which is 8.7%. The mortality of TB has also reduced by 18% during the same period in India and globally. The WHO organization, the World Health Organization, has made a downward revision of TB mortality rate from 4.94 lakh in 2021 to 3.31 lakh in 2022, a reduction of over 34%. This is a really proud moment of our ground root, our staff who is working at the ground root level and the from NTEP, like basically the major part is coming from STS who are doing regular field visit and encouraging the staffs for encouraging that patient to complete their treatment duration, which is like basically leading issues for this treatment completion over there. Apart from this, as we have discussed preventive therapy, they are also working, a lot of organizations also working to to provide that tuberculosis preventive therapy to the household contacts as well, which is playing a lead role too in the reduction of TB incidence. Apart from this, Ashas is working, DOTS provider is working. So actually the staff who is working at ground root level as well as is trading from there to all the MOs, senior MOs, DRTPs coordinator, TB HIV coordinator, MO senior MO, DTO, and apart from DTO, PPM is also over there for the working on the private notification and that all. DPC is over there. STO is over there. Apart from STO, you will STSUs is over there. STDC is over there. A lot of team is like basically working collaboratively, and they all are means that this has been achieved with their all the work collaboratively. India efforts, India's efforts have resulted in reduction of tuberculosis incidence by 16%. So once again, that's good. In 2022, from 2015, almost double the pace. So, at which global TB incidence is declining, which is 8.7%. The mortality of TB has also reduced by 18% during the same period in India and globally. So the main part is coming over here that death is getting prevented. The World Health Organization has made downward revision that we have already covered this part. The Global TB Report 2022, the World Health Organization and the Ministry of Health and Family Welfare, Government of India has agreed to publish the data for India as interim with an understanding that the WHO would work with the technical team of the ministry to finalize the figures. Following this, there were more than 50 meetings between the technical team of World Health Organization and the Ministry of Health and Family Welfare, wherein the country team presented all the newer evidence generated, the in-country mathematical modeling developed, including the data from Nikshay portal, which captures the life cycle of every TB patient during the course of their treatment. World Health Organization team intensively reviewed all the data presented and not only accepted but also appreciated the effort made by our country, India. This year, the Global TB Report has acknowledged and published the revised estimate for India with downward revision of the burden estimate, especially TB related mortality figures. The report notes that India intensified case detection strategy have resulted in the highest ever notification of cases in 2022, during which over 24.22 lakh TB cases were notified. That in between duration, that active case finding and that all the strategies has been set by the government of India that is occurring is training from the village level, ground root level to district level. That all target has to be set. So 24.22 lakh TB cases were notified in 2022 by this strategy, surpassing the pre-COVID level. The key initiative launched and scaled up by the government like specialized active case finding drives, scaling up of molecular diagnostic to block level, decentralization of screening services through Ayushman Bharat Health and Wellness Center, and private sector engagement have resulted in significantly bridging the gap in missing cases. The Pradhan Mantri Tuberculosis Mukt Bharat Abhiyan has received a tremendous response across the country with over 1 lakh Nikshay Mitras from all walks of life coming forward to adopt over 11 lakh TB patients. Under Nikshay Poshan Yojana, about rupees 2,613 crore have been disbursed to over 95 lakh TB patients since its launch in 2018. Newer patient-centric initiative like family care giver model and differentiated care have been introduced to ensure further reduction in mortality and improvement in treatment success rate. The report also notes that India has taken bold steps to prioritize TB elimination efforts with investing additional resources to the National TB Elimination Program being implemented under the aegis of National Health Mission. So, this is the part that is specifically covered from this, and will in the second of this video we will cover more detail of from the reports which has been drawn from WHO. And the next series which will come for the comparative data of India with any of another countries having population nearby to our country. I will do the next one, and I hope so. You have enjoyed this, and it's really a very good and amazing news for us that we have made a tremendous achievement in this, and which has been acknowledged in this. So, till the time, take care. Bye. Thank you.